But there's one thing I just had out that I wanted to kind of express earlier when I said ADD individuals may have dysautonomia and all that stuff and how they've been dealing with that. You know, it was funny that during my talks I mentioned those studies that these doctors are saying that very thing. And all of a sudden I get Psychology Today, and I don't know how we ended up getting this to our office, but somehow, I don't even know, the prescription might have run out. I don't even know how we ended up getting it. But I'm thumbing through it one day, this one October magazine of Psychology Today, and there's this little insights portion, and it says diagnosis, bipolarity's hidden hazards. And it basically says strokes, diabetes, and heart and respiratory diseases are the culprits. Researchers combed through 17 studies involving over 300,000 patients and found that bipolar disorders double the risk of early death from common medical conditions. So that's what I mean by dysautonomia, because if the brain waves are not functioning, your body's going to be in complete disarray. So that's just something to think about, and if we can help people understand that, that's what I said earlier when I opened up, that if your brain is not functioning appropriately, your nervous system is not functioning appropriately, there's no way everything else can function appropriately. So let's take our conversation away from the symptomatic state of all the conditions and the labels people have, whether it's rheumatoid arthritis, whether it's irritable bowel syndrome, or whether it's sciatica and low back pain, and let's bring it back to nervous system dysfunction. And people with bipolar disorder, like this article talks about, are suffering all these conditions because their nervous system is in such flux. So we can make it real to them, and who better to deal with these people with the nervous system disorders than chiropractic? Let's see the bigger picture as a profession.
Absolutely. Dr. Paul Pringle would like to say, keep turning the crank for NBC. This is salvation of chiropractic as an autonomous profession. Thanks for your input and time. It is much appreciated. Dr. Pringle is a NeuroInfiniti client who's been using it for several years. And again, you know, whether you're located in Dubai or Ireland or Australia or the United States, we've got doctors around the world getting the same results with their patients by having this information available to them and being able to communicate it back why chiropractic is true health care. All right, we'll wait just one more second and see if anyone's typing any additional questions. Oh, actually, there is another one. Dr. Joe, how often do you reevaluate a patient?
We reevaluate everybody every 90 days. They get a full SRE every 90 days. You know, and Didi had mentioned that, you know, the equipment does come with neuro and biofeedback. And part, whatever their care plan may be, we don't even talk about bio and neurofeedback until your first 90 days is over. Because first and foremost, we're a chiropractic center that also has adjunctive therapy of bio-neurofeedback. We're not a biofeedback center that happens to do chiropractic. So it's always chiropractic first. So what I need to know when I'm assessing a patient is, how are they responding to chiropractic? I need to do that as a baseline. And then if we're not getting, you know, a response in a specific area, we can start talking about bio and neurofeedback. But yeah.
And also just to add to that, most doctors, like Dr. Joe does initial and then every 90 days. We have some doctors that do it every 30 days. That depends on your technique and your analysis, yes. Or if you feel that this patient is responding or not responding, you might want to do one a little sooner. So that is totally to your discretion.
Correct. And at any point in time, you could do a focused exam, too. You can just do some of the leads. You could just do hand temperature and skin conductance. You can run them through. You don't have to do everything if you wanted to do like a small focused exam.
And I can also interject just a little bit there on the billing. One of the things is, you know, you do charge for that initial exam, and one of the things that's helping to really stimulate new patients and income for the practice is, like Dr. Joe mentioned earlier, he had a child in that they were testing for ADD, and before he was finished, the mom had made an appointment to get the scan. So, you know, that is a new patient that he would not have had he not had the initial, you know, evaluation that he did, and that happens ongoing all the time.
Yeah, and that's like I said earlier, when I'm done with the report now, previously when I started reports in the previous practice, it was, you know, here's your findings, et cetera, and they'd say, you know, ask me the standard questions that you guys get asked every day. Now, the funny thing is, after I'm done with the report and I say, okay, Dee, did you have any questions? She looks at me, this happens 99.999% of the time, and says, yeah, well, I'm thinking about my mother. I'm thinking about my neighbor. Like, the question that they have is never about them. And that's been the most profound thing for me, because I never would have expected that. So people have their kids in here. People have, you know, it's been amazing. And that's why we've started with so many people in such a short time without any outside marketing. Again, that was on accident. We never thought it would turn into this, but it really has, and it's pretty profound.
Great. Dr. Latzer has a question. How do you determine how many times a week a patient needs to come in?
Through the whole exam process. I mean, that's a bigger question. But, you know, if somebody's really exhausted, you know, I'm going to do less segments on that individual. I'm going to do them lighter. If somebody has a very, very, very good scan, you know, I'm going to say, okay, well, let's see you less often. Most of the time, and here's the funny thing, most people who have good scans have in some point in their time been under chiropractic care more than like, you know, because when you ask people, I've seen a chiropractor before, well, what does that mean to you? Well, I saw them, you know, I see them about once every 6 months to a year. Well, you've never been under chiropractic care then. So, but the people who have been under any sort of extended chiropractic care for any period of time, we find that those scans tend to be the better ones and they respond better, and it's not by coincidence. So if somebody has a really good scan, well then I could say, okay, well we may not just need to see you 2 to 3 times a week. We may be able to see you once a week. We try to get people to either a minimum of either once a week or twice a month is the goal to get people down to for any sort of maintenance level. So,
and Dr. Barwell would add into that a little bit. It's totally based on, you know, is the patient in that under-aroused state or the over-aroused state of the nervous system? So somebody who's under-aroused is going to need to be adjusted more, and somebody who's over-aroused is going to need to be adjusted less frequency, less often. So the NeuroInfiniti will let you know up front which patients are which, so that you know how that patient's going to respond to your care. So what's the difference in 2 patients coming to you with similar signs and symptoms? You put them on similar courses of care. One gets better and one doesn't. What was the difference in those 2 patients?
Exactly.
One was under, one was over, or one was unstable, or one was exhausted. So you knowing up front that those patients are going to respond, you're going to get rid of that chiropractic non-responder in your practice because you're going to know up front.
Right, and these people who are walking around having heart attacks, you know, who were normal, healthy individuals, and they're just falling down dead, they don't look any different on the outside than somebody else. So we're getting a better picture of what's happening on the inside. So yes, Didi is right. If somebody's stuck in that under-aroused system, we maybe do a little more osseous adjusting. We may see them, you know, more frequently the first couple of weeks. I may see them 4 times, 5 times in the first week or so, just to get them to kickstart it, to actually start to respond. Where somebody else, like she said, who is in the over-aroused, or even more importantly, the exhausted system, well, we need to really handle them with kid gloves. So the SRE, and there's a little more to my exam that I do, but that's neither here nor there, that's up to you. That kind of gives me a little more guidelines as to where to go with every individual. Again, this equipment is not technique specific. It's really not. I mean, it helps with determining a care plan for an individual, but it doesn't matter if you're doing CBP, if you're doing network, if you're doing upper cervical, if you're doing SOT. It doesn't really matter. It just matters if you're doing what you're doing and you're doing it correct and you're identifying who you're dealing with.
Perfect. How long does the scan take?
We have it down to a science. So the whole thing's about, from setup to takeoff during the test, about 15 minutes.
Okay. The actual scripted
and I don't
session
do it.
is, yeah, I was going to say staff-driven. The actual scripted session is 12 minutes start to finish. And in the initial, probably it will take your staff about 20 minutes. Once they got it down pat, like Dr. Joe says, you get that exam time down to 15.
And I don't do it. My staff does it.